What is the definition of anxiety disorder? A. A condition characterized by occasional worry and fear. B. A mental health condition characterized by excessive worry, fear, or apprehension. C. A condition where individuals feel nervous occasionally. D. A state of constant happiness and relaxation. B. A mental health condition characterized by excessive worry, fear, or apprehension. Anxiety disorder is defined as a mental health condition characterized by excessive worry, fear, or apprehension that significantly impacts daily life. This definition encompasses the core features of anxiety disorders, distinguishing them from occasional feelings of nervousness or worry. Which of the following is not a type of anxiety disorder? A. Generalized anxiety disorder, GAD. B. Bipolar disorder. C. Panic disorder. D. Social anxiety disorder, SAD. B. Bipolar disorder. Bipolar disorder is a mood disorder characterized by fluctuations between episodes of depression and mania. While it can involve symptoms of anxiety during certain phases, it is not classified as an anxiety disorder. What are common symptoms of anxiety disorders? A. Muscle tension and fatigue. B. Excessive happiness and euphoria. C. Persistent feelings of contentment. D. Increased appetite and weight gain. A. Muscle tension and fatigue. Common symptoms of anxiety disorders include physical symptoms such as muscle tension, fatigue, restlessness, as well as psychological symptoms like excessive worry and irritability. These symptoms are characteristic of the heightened state of arousal associated with anxiety. Which therapeutic approach is widely used for treating anxiety disorders? A. Psychoanalysis. B. Behavioral therapy. C. Cognitive behavioral therapy, CBT. D. Humanistic therapy. C. Cognitive behavioral therapy, CBT. Cognitive behavioral therapy, CBT, is a widely used therapeutic approach for treating anxiety disorders. It helps individuals identify and challenge negative thought patterns and develop coping strategies to manage anxiety effectively. What neurotransmitters are often associated with anxiety disorders? A. Serotonin, dopamine, and gamma-aminobutyric acid, GABA. B. Adrenaline and endorphins. C. Cortisol and oxytocin. D. Acetylcholine and glutamate. A. Serotonin, dopamine, and gamma-aminobutyric acid, GABA. Imbalances in neurotransmitters such as serotonin, dopamine, and gamma-aminobutyric acid, GABA, are often associated with anxiety disorders. These neurotransmitters play key roles in regulating mood, emotions, and the body's stress response. What is a hallmark symptom of panic disorder? A. Persistent worry about various aspects of life. B. Recurrent and unexpected panic attacks. C. Intense fear of social situations. D. Intrusive thoughts and repetitive behaviors. B. Recurrent and unexpected panic attacks. Panic disorder is characterized by recurrent and unexpected panic attacks, which are sudden episodes of intense fear or discomfort. These attacks can be accompanied by physical symptoms such as palpitations, sweating, trembling, and shortness of breath. Sarah has been feeling increasingly worried and on edge for the past few months. She finds herself constantly fretting about her job performance, even though her colleagues and supervisors have praised her work. She often feels restless, has trouble sleeping, and experiences muscle tension throughout the day. Sarah's symptoms seem to be interfering with her ability to focus and enjoy daily activities. Based on Sarah's symptoms, which type of anxiety disorder is she most likely experiencing? A. Generalized anxiety disorder, GAD. B. Panic disorder. C. Social anxiety disorder, SAD. D. Specific phobia. A. Generalized anxiety disorder, GAD. Sarah's symptoms of chronic worry, restlessness, and muscle tension are indicative of generalized anxiety disorder, GAD, which involves excessive and persistent worry about various aspects of life. Mark experiences sudden and intense episodes of fear, accompanied by palpitations, sweating, trembling, and a sense of impending doom. These episodes often occur without warning and can last for several minutes. Mark worries that he might be having a heart attack during these episodes, which leads to further anxiety. What disorder does Mark likely have based on his symptoms? A. Generalized anxiety disorder, GAD, B. Panic disorder, C. Obsessive-compulsive disorder, OCD, D. Post-traumatic stress disorder, PTSD. B. Panic disorder. Mark's sudden episodes of intense fear accompanied by physical symptoms like palpitations and trembling are characteristic of panic disorder, which involves recurrent panic attacks. Emily dreads social gatherings and often avoids attending parties, meetings, or other events where she might have to interact with unfamiliar people. She fears being judged or embarrassed in social situations and experiences physical symptoms such as sweating, trembling, and nausea when faced with these situations. Which anxiety disorder best describes Emily's experience? A. Generalized anxiety disorder, GAD, B. Panic disorder, C. Social anxiety disorder, SAD, D. Specific phobia. C. Social anxiety disorder, SAD. Emily's fear of social situations and avoidance behaviors, along with physical symptoms when faced with these situations, suggest social anxiety disorder, SAD. David has a debilitating fear of flying and avoids air travel whenever possible. Even the thought of boarding a plane triggers intense anxiety and panic attacks characterized by shortness of breath, rapid heartbeat, and a sense of impending doom. What type of anxiety disorder does David likely have? A. Generalized anxiety disorder, GAD, B. Panic disorder, C. Social anxiety disorder, SAD, D. Specific phobia. D. Specific phobia. David's fear of flying and avoidance of air travel indicate a specific phobia, which involves an intense fear of a specific object or situation. Jennifer experienced a traumatic event several years ago when she was involved in a car accident. Since then, she has been plagued by intrusive memories, nightmares, and flashbacks of the accident. She avoids driving or riding in cars whenever possible and feels constantly on edge. Which anxiety disorder is Jennifer most likely experiencing? A. Generalized anxiety disorder, GAD, B. Panic disorder, C. Social anxiety disorder, SAD, D. Post-traumatic stress disorder, PTSD. D. Post-traumatic stress disorder, PTSD. Jennifer's symptoms of intrusive memories, nightmares, avoidance of triggers, and hypervigilance are consistent with post-traumatic stress disorder, PTSD, which can develop after exposure to a traumatic event.